Second speaker is Dr. Jin Young Park. She is currently IARC and leads the gastric cancer prevention team at IARC. Her research involves a broad range of international epidemiological studies on H. pylori infection and gastric cancer. And she currently moderates the HELPER study and the G-STAR study for the Global Gastric Cancer Prevention Program. And she will talk today global effort for the prevention of gastric cancer. Dr. Park, please.
Thank you very much, Professor Jung, for your introduction. And good morning, everyone. It's such a great pleasure to be here. And then I'm so honored to be part of this Gastric Cancer Summit. And then I thank the organizers for the kind invitation. So my name is Jin. I'm leading gastric cancer prevention team at the International Agency for Research on Cancer, which is a specialized cancer research agency of the World Health Organization. We are based in Lyon, France, so I'm quite jet-lagged, but I'll do my best to give you some overview of what we are doing in collaboration with many global partners to tackle the gastric cancer together. So today I'm going to talk about ongoing efforts, but mainly focusing on primary prevention that IARC is engaged in mostly. So we are all here because gastric cancer is an enormous public health problem, and then it will remain important for the foreseeable future. And Professor Shah already provided really nice overview of the burden, so I will make it very quickly. So gastric cancer ranks at the 5th in terms of incidence and mortality, and then we know that gastric cancer burden mostly come from Asia, especially in China. I just wanted to also show this graph, which shows incidence on the x-axis, the mortality on the y-axis, and each dot actually represents each country, and then it's color-coded by different continent. And as you can see, the incidence and mortality aligns really closely. But the exception for that is Japan and Korea, where gastric cancer incidence is really high, but mortality is fairly low. And we think it's due to the prevention programs in place in those countries. I would like to focus on, despite the Dr. Shah already showing the decreasing trend, despite the trends happening in many countries, I would like to emphasize the future, the absolute burden will only increase due to demographic changes. So this one shows in 2050, we will have more than double, almost double the number of new gastric cancer cases. And then these demographic changes is depicted in the blue. And the mortality, we have also the similar, a really big increase in terms of number of gastric cancer deaths. The most interestingly and also importantly, the greatest increases are predicted in countries assigned to a low, medium human development the Human Development Index. And this HDI is a broad marker of inequality and also cancer transition between countries. So from these figures, we expect actually a wave of new gastric cancer cases in lower richer settings, which basically requires our attention because we need more affordable preventive strategies. This one is similar graph as before, but the estimated number of new cases in 2050, actually this graph shows that while we will have to still cope with this continued high burden in high-risk areas, we will also have to face and then also they expect this the increasing number of cases in those regions in Emerald, Paho, Afro, by WHO region. And in 2013, IARC convened a working group of experts to discuss H. pylori eradication as a strategy for gastric cancer prevention. And then many of you actually have come to the agency and then contribute to the meeting. That was 10 years ago. We were younger and then probably a bit. At the time, the working group recognized that gastric cancer is a large, already then, a persisting global burden, on which urgent action is required. In addition, as Dr. Shah already said, like we know its principal cause, and then this H. pylori infection, which is actually treatable. So this high global burden and then also the known principal cause and its feasibility of treating with antibiotics makes the gastric cancer really a logical target for intervention. So at the time, the IARC, the working group was composed of like 19 external experts and 11 IARC participants. And we talked a bit more about like, the health effects and consequences of H. pylori eradication then as a prevention strategist for gastric cancer. And then the working group recognized this like high persisting burden, and they urged like that countries with high risk introduce population-based H. pylori screening and treatment programs. However, of course, in the conjunction with a scientifically valid assessment of program processes, feasibility, effectiveness, and possible adverse consequences. It's been around 10 years or more since the last working group meeting was held. And then in this talk, I'm going to present then ongoing international initiatives on H. pylori eradication for gastric cancer prevention that IARC is actively engaged in. So that is namely HELPA, GSTAR, and the European initiatives. So the HELPA study, very briefly, it's one of the most important ongoing initiatives on H. pylori eradication for gastric cancer prevention. And HELPA is a clinical trial that aims to evaluate the effect of H. pylori eradication on gastric cancer incidence in the middle-aged Korean population who is attending the biannual endoscopic screening program in the country. The main study was launched by the National Cancer Center Korea. The PI of the study is Dr. Il Choi. That was like, the study was launched in 2014, so it's exactly 10 years ago, and in collaboration with IARC. So we were very pleased that we managed to complete our recruitment in 2019, right before COVID started. And so we enrolled around 12,000 participants, and 5,269 participants were randomized into the bismuth quadruple therapy or placebo. And biannual endoscopic active follow-up is ongoing within the screening program, and interim analysis is planned within the next year. So we will be hopefully providing you more information in the next summit. So we recently also celebrated this important anniversary of 10 years of the HELPA study in Korea. The next study that I'm going to briefly present is GSTAR, which is a population-based also clinical trial that's been conducted by the University of Latvia in collaboration with IARC. So it is led by Professor Marcis Lea, and the GSTAR study is has a bit different study design than HELPA because it is conducted in a European setting. So it aims to determine whether the eradication of H. pylori combined with pepsinogen testing and the subsequent referral of those who have positive pepsinogen testing to endoscopic examination, whether that will reduce the gastric cancer mortality in middle-aged Latvian population. So basically, we also, this one is actually the largest and then also for the moment, the oldest gastric cancer prevention study existing in Europe. And we also managed to recruit more than 10,000 participants. That was already 2021. Prior to conducting the main study, we actually launched a pilot study in 2015 in 4 study centers in Latvia. And at the time, we recruited 3,400 subjects, and H. pylori prevalence was really high. But the eradication success was around 87% at the time. And we also did more than 1,000 endoscopic examinations with full histological assessment. So this is by far the largest, as a pilot, the largest endoscopic study existing in Europe. And we also offered fit tests as a benefit of the study participation for the study participants. And main study is being continued in 7 additional study centers, and we've been recruiting more than 11,000 throughout the country. And the follow-up visits are ongoing as part of these European initiatives that I'm going to present briefly in the next slides. So the G-STAR study has a very important role in the European setting because the European Commission announced the Europe Spitting Cancer Plan in 2021. And at the time, the gastric cancer was addressed under the section of preventing cancers caused by infections, meaning the primary prevention approach, and then secondly, under the improving early detection of cancer. So they tried to explore whether the gastric cancer can be part of this extended screening program that will be recommended throughout Europe. Then SAPIA, the part of the European Commission's Scientific Advisory Board, recommended the population-based screen and treat of H. pylori will provide the key opportunity for gastric cancer reduction in the continent. So in response to the Europe Spitting Cancer Plan and then also the subsequent recommendations made by the Commission, EU launched major initiatives for gastric cancer prevention, and for which IAC plays actually an important role. So it is namely Eurohelicon, TOGAS, and European Commission Initiative on Gastric Cancer. And I'm going to talk briefly about each of them in the next slides. So Eurohelicon is a small project, but I really love the consortium because we are partnered up with the National Public Health Institute of Slovenia, with University of Latvia and University of Nantes. And we are actually trying to pilot the H. pylori test and treat programs in young Slovenian adults population, and that is the main pilot study that we have over there. But IAC has been tasked to host an IAC working group meeting, which I'm going to talk a bit more about it in the next slides. So we aim to provide global guidance on the implementation of population-based H. pylori screen and treat strategies for prevention of gastric cancer by convening an expert group focusing on primary prevention strategies. So this IAC working group meeting that we are planning is an actually update of the previously mentioned 2013 working group meeting. And that will be held in February next year. But we will more focus on programmatic aspects of the implementation itself rather than discussing more about whether to do it or not. Despite the fact that this is part of Eurohelicon project, our aim is, of course, to make the recommendations coming from the working group more globally applicable. And core working group members include Professor Ichali, Paul Moyadi, Constanza Camargo, Iris Vujala, and Boyan Tepish. And I'm pleased to say also that Dr. David Foreman will give us a keynote speech, and then he was one of the main organizers of the 2013 working group meeting, so it will be a nice bridge. So we'll hopefully provide us the update on this specific working group meeting. Very briefly about preliminary outline of the report. As you can see, that we try to cover the really practical aspects and the essential considerations that need to be made when implementing population-based H. pylori screen and treat programs for gastric cancer prevention. And this, under these examples of ongoing gastric cancer prevention efforts, we have been describing all those the ongoing efforts by WHO region. So we've been working tirelessly for already for a year and a half for this meeting, and we are currently at the stage of the finalizing the chapters. We are at the end of the peer review process. So the IARC working group report will be published in a dedicated IARC and WHO publication platform, and we also expect to publish at least 2 manuscripts in high-impact facts journals related to the meeting and the report. I'll touch briefly based on the TOGAS project, because it's an even larger project and larger efforts with 21 consortium members with from the European institutions. And TOGAS project has a general aim to provide the missing evidence-based knowledge needed for recommending appropriate implementation of gastric cancer prevention and screening programs across the EU, which has never been there. So you can see that there are 3 pilot studies. So the first pilot study is trying to evaluate this feasibility of implementing H. pylori screen and treat strategies in 6 different European countries. Pilot 2 is actually trying to explore whether combining upper endoscopic examination with existing colorectal cancer screening, especially like those who are referred to colonoscopy, will be feasible to implement in the European settings. Pilot 3 is using the GSTA study that I mentioned previously. We try to address like any long-term consequences of these preventive strategies for gastric cancer. So all this extensive knowledge and experience that we are gathering from the ongoing the global efforts, we hope these can be reflected in some guidance instruments, for example, European Commission initiative on gastric cancer, which is upcoming. So normally, they already have like 3 existing guidelines which have been updated continuously for cervical cancer, breast cancer, colorectal cancer. So gastric cancer is the 4th cancer site that we are preparing for the moment, and IAG is taking a lead on development of European guidelines. So normally that the guideline development covers the entire spectrum of from the primary prevention till the care, palliative care. But we will roll out this project, firstly focusing on primary prevention, and then to be complemented by these quality assurance manuals and tools. Then this work will be then followed by the screenings, diagnosis, and treatment of gastric cancer in the 2nd set of the guidelines. So with this, I would like to acknowledge that there is a gap between the knowledge and the evidence-based interventions and then their actual implementation in prevention programs. And as you can see in the figure on the right-hand side, I think we really need to collect more information on these, like from the implementation studies and effectiveness studies, and to collect more information on actually like how these programs can work in real-life settings. So the outcomes from the ongoing international initiatives focusing on this primary prevention strategy will hopefully like fill some of the identified gaps. And also this will be then reflected in the global guidance instruments and also the European guideline work, which is coming up soon. So with this, I'd like to thank you for your attention. I would like to acknowledge my colleagues for the IR working group meeting preparations. Thank you very much.
Thank you.